education, income, and health are all very interrelated. And I don't think that we as United Ways can look at them in silos any longer. We need to look at an integrated approach so that we can best benefit our community and make the biggest long-term impact in the lives of children and families through this integrated approach. The advice that I would give to other United Way CEOs that are looking at doing this is that it is by far an easier message. And it's so much easier to be able to sell what we do as United Ways when you have one message, and that message be consistent no matter what group of stakeholders you're talking to, whether it's in the workplace, whether it's high wealth donors, whether it's foundations, that the message is consistent about solving the problems of low-income children and families in our most challenged neighborhoods. And because education is the key out of poverty, but there's so many other barriers to success that involve income and health, then it makes it a much more concise message when we can talk about all three of those things together. I would also suggest that as a United Way is moving in this direction, that it's very important to build consensus, whether that's at the staff level, at the board level, or within the community, and to have the United Way and the United Way CEO be seen as the catalyst for this work in the community. The CEO will be seen as a leader, will be seen as a change agent, and will be seen as somebody who really cares about making the community stronger for kids and families. And by doing this integrated approach, our communities become so much stronger. United Way of Salt Lake has been doing this work really since 2007. And we integrated education, income, and health in 2008. And the progress that we're seeing in our communities is so much greater than just doing random acts of programming and throwing money at problems that don't get any better. Because by integrating and having a common agenda, data-driven, having United Way be the backbone, we can actually see change happening. And in our community, we're really seeing that. If we had it to do over again, and I would say that there are some things that we learned. We have really struggled with income part of this. Income is much more difficult to get data on. It's much more difficult to measure. So we've had some stops and starts as far as the income area goes, and we're just now looking at how we can really make this the third piece of the integration. And we're doing some good things as far as mobility rates, chronic absence. We've always done ITC, but that doesn't really get you where you need to go in communities. So we're looking at skills gaps and job training and things like that. But we should have started that a long time ago. And the advice that I would give to other United Ways is to try and do all three of them in an equal measure from the beginning. We started with a big focus on education, and then brought health and income in later, and seeing great results with health, but are just now starting to see some good results with income.